today. We have several guests and community partners that you are going to hear from shortly, including the Commissioner of the Monroe County Public Health Department, Dr. Michael Mendoza, Congressman Joe Morelle, Jamie Saunders, the President and CEO of the United Way of Greater Rochester, and Irondequoit Town Supervisor Dave Seeley. It seems hard to believe, but we are quickly approaching the 2-month mark from the first positive case of COVID-19 in Monroe County. For nearly 2 months, we have preached the importance of regularly washing and sanitizing your hands, maintaining a physical distance of at least 6 feet from others, and wearing face covering when out in public. In recent days, talk has turned to reopening, how we measure up against the benchmarks outlined by the governor, and whether we're on the right track. But it's important to remember that as we start to reopen, those same healthy habits are going to be even more important to maintain our progress and ensure that we don't go backwards. One of those healthy habits, proper face coverings, is what we're here to discuss today. Thanks to our federal partners, especially Congressman Morelle, Senator Schumer, and Senator Gillibrand, we've been able to use the CARES funding to secure a large supply of surgical masks that our team has been providing to partners across our community, allowing them to deliver essential services safely. To date, Monroe County has distributed over 1.1 million mask coverings to area skilled nursing and long-term care facilities, assisted and independent living centers, first responders, daycare facilities, and numerous other essential businesses. We've worked with United Way to provide 130,000 face coverings to area community-based and nonprofit organizations and group homes. And we've partnered with FoodLink to distribute 75,000 face coverings in their food baskets, enough for 1 month's supply for each of FoodLink's recipients. I am proud of the work that we have done and the contributions we have made to ensure the people who are working on the front lines have the equipment they need and are properly protected during these unprecedented times. But today, we are going to take this one step further. As we continue to learn more about the spread of this highly contagious virus and the impact that it has had on our community, we are constantly looking for ways to keep our residents safe and further protect them against community spread. This is why I am proud to announce that Monroe County is working with our local government partners to provide residents with more of these much-needed face coverings. We are utilizing the resources the county has been able to gather to provide face coverings to those residents who need them, and will be working with the City of Rochester, town and village governments to distribute these face coverings at no additional cost or fee. Our team is working to provide over 1 million masks to the local towns and villages who will begin distributing to their residents this weekend. We've also committed to providing 500,000 masks to the City of Rochester and will be working with them on announcing a distribution plan in the coming days. Now more than ever, it is critically important that all Monroe County residents continue to wear their face coverings whenever they are out in public. Our community has done an incredible job of flattening our curve and slowing the spread of this virus. I'm incredibly grateful for the dedication we have all shown to keeping this community safe and healthy, but I also want to caution that we are not out of the woods just yet. We know that face coverings are going to continue to be an essential part of our daily lives for the foreseeable future, even as we progressively reopen our local economy. I have received many emails and phone calls, especially after the nice weekend we just had, from residents expressing concern about seeing others not wearing their masks while in stores or otherwise out and about in public. My hope is that by expanding our face covering distribution, we'll make it easier for people to have face coverings, access to those coverings, and eliminate any excuse for not having face coverings when you're out in public. We know that as we continue to experience nicer weather, more people are going to be outside. What we're asking is that you keep your face covering handy for when you're not able to maintain at least 6 feet of physical distance. I want to go back to our old way of life, just like everyone else. My family is anxious to be able to see our friends and family again, be in close proximity, and to be able to enjoy the summer months and everything our community has to offer. But the unfortunate reality is that this is not going to happen overnight, and we need to do everything we can to continue to fight the community spread of COVID-19. And we are asking for your continued cooperation, and we're asking for teamwork in this effort. I have no doubt that the actions that we have taken over the last couple of months have saved lives, and we have slowed the spread in our community. And now is the time not to give up and it's not to undo all that sacrifice that's been made in this community, but to now look as how we move forward, how we start to reopen in the phases ahead. And one of the most critical components of doing that is utilizing face coverings. And with today's announcement, we're going to be able to provide those face coverings to every Monroe County resident who is in need. So now I'm going to turn this over to Commissioner Dr. Michael Mendoza to talk a little bit about the importance of face masks and face coverings and when it comes to the spread of COVID-19.
Thank you, County Executive, and I also want to extend my gratitude to Congressman Morelle for Jamie Saunders, President and CEO of United Way, as well as to Supervisor Dave Seeley and all of the other government partners who have joined us here today to share this wonderful news with our community. It has been nearly 2 months since we asked Monroe County residents and businesses to take the unprecedented step of quarantining in their homes, of shuttering their businesses, and establishing a new way of life that included social distancing and staying away from family, friends, and neighbors. In that time, we have put in place additional measures to protect our public health, most notably the expectation of physical distancing, for stepping up hand hygiene, and for improving even further our efforts to maintain environmental disinfection. And more recently, we've learned of the very real possibility of asymptomatic spread. The thought that any one of us, even though we're feeling perfectly well, has the potential for spreading COVID-19 to somebody else inadvertently. So therefore, in line with the CDC and the New York State Department of Public Health, we issued a local recommendation that everyone wears a face covering in public whenever there could be a chance that the 6 feet physical distancing might not be feasible. This was big, this was new, and so far we've done it. And while the residents of Monroe County have answered the call and have helped us to flatten our curve and so far avoid that dreaded spike, today I am renewing my call for your understanding, for your patience, and for your cooperation. As you all know, we saw some very beautiful weather just this past weekend, weather that reminded us yet again of all of the people and all the things that we miss so much about our community. And understandably, it also brought out a number of people, many of whom were not physically distancing and who were not wearing their face mask. Look, we are all excited for the promise of warmer weather and all of the things that that brings, for the potential of reopening our businesses, of enjoying a meal with friends and family, of going out in public and taking a walk without having to worry. I share this same desire just like everybody else. But in our enthusiasm to rediscover normal, we cannot forget those who we have lost and those who are currently fighting for their lives in our nursing homes and in our hospitals. And we also cannot forget those on the front lines who are spending day and night taking care of our loved ones and our friends. To properly honor those we have lost and to show our respect for those on the front line, we cannot be satisfied with only having flattened the curve. We must now commit ourselves to keeping it that way. In spite of how far we have come, of our commitment to our loved ones, our older adults, and the most vulnerable among us in our community must only grow. Doing anything less risks the very real possibility of causing a surge in cases that could send us right back to square one and force us again to close down our economy and shutter ourselves back in our homes. And so today, I again want to underscore the importance of continuing to maintain that physical distance, of continuing to be mindful of our hand hygiene and our environmental disinfection, and again, to reissue the call to wear a face covering or a mask in public whenever there's a possibility that you will not be able to maintain that 6 foot physical distance between yourself and others. This is especially important now as we look ahead to reopening businesses and to reconnecting with our loved ones and our friends. That is why this partnership today with every town and every village and the city of Rochester is so exciting and so important. I want to ensure that everyone in this county has the ability to make the right choice. So please join me in making the choice to protect our loved ones and to ensure a healthy future for all residents of Monroe County.
And next, we're going to hear from Congressman Joe Morelle, without whose support today's announcement would not be possible in being able to secure those fundings through the CARES Act to be able to allow us to purchase these masks and be able to distribute them to residents across the county. So, Congressman Morelle, thank you for your help and your support, and I will turn it over to you.
Good afternoon. It's always a privilege to join my friend, the county executive, who I think has done just an amazing job. And I think whenever I talk to my colleagues around the country, I'm reminded again of how fortunate we are to have the leadership of Adam Bello and Mike Mendoza at the County Health Department. Also great friends like Jamie Saunders and the United Way and all the work that they're doing in the human service space to make sure that people remain connected. And then great friends like Dave Seeley, who's doing just an outstanding job in the town of Rondequoit, where I happen to live. So I'm particularly, interested in the great job that Supervisor Seeley's doing. Before I get into this a little bit, I just want to just note how many diplomas Mike Mendoza has on the wall behind him. I think my entire family doesn't have as many diplomas as Mike Mendoza has. I'm not sure. You might be a show off, Mike, but I think that means we're in good hands. So I appreciate that and appreciate all the great work you're doing in your friendship. You know, throughout this crisis, and we look for, obviously there's a lot of challenges. We're all facing challenges. My constituents, Adam's constituents, Dave's constituents, all the people we deal with, families, the whole country is dealing with the challenges. But what has been remarkable is the number of positive stories that are coming out of this. There is so much positivity. We talk to the human service agencies on almost a daily basis, which Jamie leads, and just the extraordinary stories, even strangers helping strangers, neighbors helping neighbors. I think the impulse to do positive, good things is so much a part of the human experience, and we're clearly seeing that over the course of the last couple of months, and obviously we're going to need to continue to see that happening. And I think today is another part of that positivity. I think as the county health director mentioned, you know, one amazing thing about this virus, it can't live on its own. So it needs us as its host. And one of the ways we stop the virus is, frankly, staying apart from one another. That's why the social distancing is so critical. It can't go more than 6 feet and live unless we allow it to. And that's why it's so important to have face masks and face coverings. It allows us to stop the spread of the virus. It is unique in some ways in that it differs from bacteria and other things, and it just can't live on its own. It needs us as a host, or it needs living cells. So when we're in Washington and obviously back home where I'm spending the bulk of my time and communicating with local leaders, one of the things that's important is to be able to give resources to local communities and then allow them to make the decisions about what's in the best interests of the people in their community. And that's why I'm so pleased that the county executives taking this step. You hear about personal protective equipment all over the country. You hear about the shortages, you hear about the challenges that it's faced, and you hear many people who still have not taken perhaps the advice to be able to have a face covering when they go out in public. And look, it is unusual. I mean, we're all just, I think, getting acclimated to it. I know I didn't like it the first time I had to wear mine, and it now has become more of a routine. But for many people, it's still an alien thing. But I think as Dr. Mendoza has continued to say, and appreciate his leadership, it is so critically important if we're going to slow and hopefully stop the spread of this virus. So I want to thank my community partners, my government partners. This is the way that government should be run, how community should be run. People coordinated, working together, communicating with each other, sharing best practices. And I'm just so proud and privileged to represent this community. It's an amazing place. And again, I want to thank the county executive for his incredible leadership. So thank you.
Thank you, Congressman, and thank you for your support and partnership. As Congressman noted, we're one of the few places, I think, around the country that has had such a strong collaboration between our local, state, and federal partners in fighting COVID-19 and the effects and the impacts it's had on our residents. And the partnership that we've had with the Congressman over the last several months has been critical in our ability to succeed and to keep that spread low here in our community. So thank you very much for your support and your help, particularly with this great announcement that we're making today. I'd also like to recognize and call up next the President and CEO of the United Way of Greater Rochester, Jamie Saunders, a leader in our community who has been a great partner in helping us to distribute face coverings throughout the community to people who are most in need over the last month or so. So Jamie Saunders, I'll hand it off to you. Uh-oh. Okay, so I think we're having a technical difficulty with Jamie. So while we try to fix that audio issue, I'm going to turn it over to, again, another government partner who we've been working very closely with over the last several months, my friend Dave Seeley, this town supervisor of the town of Irondequoit, who could talk a little bit about how these mass distributions are going to work and why this is going to be so important for residents across our county. Supervisor Seeley?
Thank you, County Executive. I'm happy to pinch it for Jamie, although I probably would never do her justice. But I want to thank you for organizing this. Adam's doing a terrific job. Talk about trial by fire, and I think he's longing for some normalcy in his tenure, but we feel grateful every day that he's serving Monroe County and doing a terrific job. And certainly Congressman Morelle has been busy, but I don't think if you go around countries, you'll see congressmen so engaged in the disaster responses you've seen. He's interacting not only with his state and county partners, but also with other town supervisors, mayors, et cetera. And it's not just lip service. He wants to be able to help take what he can, information he can to help inform his decisions back in Washington, but also lend his expertise as being someone who's been in government for over 3 decades now. And Mike Mendoza, I don't know, I think he has several clones because he's always so quick to get back to people and seems to be everywhere. And another person we feel very fortunate to have. And just Jamie in general, we brag a lot about the United Way and the size relative to other communities. And, a lot of people might not ever recognize what that means, but I think now we're seeing the value of having such a robust infrastructure with our United Way that's so well established and operates so efficiently and effectively. So she's done terrific work, as have all the non-for-profits that we've been working with. So in general, when this happened, I think a lot of town supervisors like myself and perhaps village mayors were kind of wondering how we all fit into this, because when there's a snowstorm or a natural disaster or a weather emergency, that's when towns really mobilize. But when it's a public health crisis, I think our role is a little bit less defined. And you see that more under the leadership and supervision and guidance of the state, federal, and county governments. And I think a lot of town supervisors like myself wanted to figure out how we could help the effort in helping us deal with COVID and helping get help to people, because the number one job of government is to preserve the welfare of its community. And that's what we all take very seriously and wanted to play a part in. Actually, it wasn't last month. In March, the town of Irondequoit began working with Food Link, which is funded through the efforts of the United Way and the county, and money secured by Congressman Morelle as well. We worked with Food Link to help establish a distribution channel for their efforts to help get food into the community. They were looking to branch out and really establish a hub and spoke model where they could have adequate supply throughout their region. And the town of Irondequoit stepped up and served as that distribution channel. We have that infrastructure. We have the personnel. We have the trucks. We have the buildings. We have the personnel. That's something we can do. And I think it's relatively easy for us to mobilize in that regard, because it's things that we're used to doing. So I know a number of towns have followed suit in serving as that distribution channel for Food Link and having regionalized food distributions in their community. So when this came up, I think it was, what was it, yesterday, Adam joined our biweekly county town supervisor and now village mayor call that we do to help coordinate our efforts and communicate with one another. Adam got on, and within, I think, an hour, we had a day set up on Saturday where I think all but one town will be having a masked distribution staged event in their community. It will be at the same time on Saturday, which we felt was important because that coordination really is key. What you're seeing take place in Monroe County with all of our towns communicate daily with the counties individually, and with the state for that matter. But just as the governor has I think, put into motion a very effective multi-state strategy surrounding the downstate area, Connecticut, New Jersey, Pennsylvania, those states, in the effort to coordinate reopening and other elements to make sure they're doing it in sync and one doesn't step on the other, perhaps have an adverse impact on another state. The towns and the villages have started to recognize the need to do that. So it not only extends to things like doing a coordinated mask or food distribution, you're looking at that coordination level among matters such as summer recreation and large special events in the summer, knowing that what one town does or does not do might impact the decisions that their constituents make to go to another town. So we're all mindful that we're in this together. We've never seen this, but working together, we're sharing common practices, but also being able to coordinate. And again, we embrace these opportunities to be able to help the county executive, get the help to the people. I think that's what we want to make sure we're doing at the town and village level, and as well as in the city of Rochester. I will note, I do like these events, whether it's a food distribution or something like this, because A, you are getting help to people, but we drastically miss seeing our constituents. Town hall has been very empty and lonely these past few months, and we miss our constituents, and we long for the day where we'll be able to see them on a regular basis in the coming weeks, perhaps. But for now, this affords us the opportunity to see them, see how they're doing, and also get them something that they valuably need. And I'll just reinforce the comments that Dr. Mendoza, Congressman Morelle, and County Executive made about the importance of these masks. Our community has 50,000 people. We're going to see people migrating more to the normalcy of life where human interaction is part of that. And I think it's vital that people take very seriously the need to utilize these masks, especially when we aren't able to socially distance. It's going to be a requirement of people entering into town hall when we open back up. And we want to set a good example for the rest of the community. So I want people to adhere to what, heed the advice that they're hearing and to recognize the importance of these masks. The county is providing us with an informational kind of one-pager for people, because wearing a mask isn't as simple as just putting it on. There's actually quite a bit of nuance to wearing a mask in a public health crisis. So we'll be giving that out with every mask we distribute. We ordered 100,000 from the county. They were delivered, actually we picked them up at 8 a.m. this morning. So the supply chain is running very efficiently, and we look forward to having our distribution at Town Hall this coming weekend, and most likely another event next week. So I just want to thank all my government and nonprofit partners for their help in this. And on behalf of all the towns and villages, we are committed to helping whenever you need us. Thank you, Adam.
Great. Thank you, Supervisor Seeley, and thank you for your help and partnership with this, and for organizing the supervisors. All the town supervisors have been great partners in this and in this effort. I think we are now joined again by the President and CEO of the United Way of Greater Rochester. We're going to try to see if Jamie's microphone's working. Jamie, are you with us?
Does it work this time?
It does. So I thank you for joining us. I'm glad we got you. I'll just say this, Jamie Saunders and her team at the United Way have really just been terrific partners in working with us on a lot of different aspects related to the effects of COVID-19 across the community. And today, one of the things we wanted to talk about was the partnership that we've had in getting hundreds of thousands of masks out to individuals in the nonprofit and community-based organizations around the county, and then also the ability to link up with FoodLink to get these face coverings out through the food distribution boxes as well. So Jamie Saunders, President and CEO of the United Way of Greater Rochester.
Great. Thank you, County Executive, and thanks everyone for your patience. I feel like I'm on Zoom calls all day, and of course had a little hiccup, so thanks so much. Today's announcement is yet another example of how our community is coming together in big ways to respond to a universal threat. These last 50+ days have felt much longer, much harder, and unlike anything we have dealt with in our lifetimes. Yet these weeks have also clearly demonstrated what is possible, what we are capable of when we come together as a community. While we have been successful in slowing the spread with our social distancing, we have also come together to make big things happen just like today, and this shows our strength. Today's announcement is another great step in helping to stop the spread and to support our community by making cloth face coverings available to residents. For the last 8 weeks, your United Way has worked with our community leaders to ensure our human service agencies and their clients have what they need to stay safe. In the early weeks, this was extremely difficult as the entire world was searching for PPE of masks and gloves, cleaning supplies and hand sanitizer, and the supply chain simply wasn't there. It was thanks to you, our community, who in the first few days of COVID-19 stepped up to support the Community Crisis Fund, a partnership of United Way and the Rochester Area Community Foundation. With your support, we were able to secure an initial order of much needed supplies for our human service agencies who remained open providing essential services. But we needed more as the weeks went on. I want to thank County Executive Bello and Monroe County and Congressman Morelle for stepping up big time by providing pallets upon pallets of hand sanitizer and over 130,000 disposable masks, which we were able to quickly distribute to a network of 80 agencies and their clients to protect those who are on the front lines, those at the FoodLink emergency food distributions, those at our homeless shelters, domestic violence and youth shelters, residential centers, group homes, medical transports, veterans agencies, and so many more. The Community Crisis Fund has received more than $4.4 million in donations from foundations and individuals across our community, and more is needed. Just this morning, Rochester's own Paychecks Charitable Foundation announced an astounding $1 million donation to support United Ways across the country in COVID crisis response and recovery, with $750,000 of that staying right here in Rochester. Our residents, businesses, nonprofits, and government leaders continue to come together to fight this pandemic and to help one another, and it's incredible to witness. You, our creative, generous community, stepped up again. Thank you to our volunteer mask makers. Talented individuals across our community are committing time and materials to create and donate homemade cloth face coverings to agencies throughout our region. After only a few weeks of launching this initiative, we have received more than 9,000 homemade cloth face coverings. These virtual sewing circles and individuals are each making these homemade masks with love and care for each of these essential workers. Talk about community. Our goal remains 50,000 homemade face coverings to support local human service providers, as the homemade coverings are washable and reusable for staff and clients. And this complements the great announcement today of these disposable face coverings that are available for residents and individuals. Both are needed. If you are able, we ask community members and volunteers to keep helping and donating your homemade face coverings to any Goodwill location, which will in turn give directly to a human service agency for their ongoing use. We need this now, especially as nonprofits are experiencing an overwhelming influx of demand from more and more individuals who are turning for help for services, many for the very first time. Calls to 211 have more than tripled compared to this time last year. 211 is our community's central resource and is the first place to turn for information and to connect to community resources. If you are in need of help or know someone who is, please contact 211, which is available 24/7 online at 211lifeline.org and by text. And shorter wait times on weekends and not on the lunch hour. Our community continues to help also by safely volunteering. More than 2,000 of you have done so in person and virtually for many of the food distributions that we just heard about, and there are 50 virtual and in-person opportunities right now on Volunteer United. Please check back often, as this is updated daily. I do not exaggerate when I say that your donations and volunteer hours and what the county is doing today literally save lives. They help keep the doors open of many of our critical nonprofit organizations, which play a vital role in our vibrant community. A leader of a local nonprofit sent me a recent email in response to a PPE donation, one of 200,000 donations recently made. And they said, and I quote, "If you could see through my eyes, you wouldn't look at this like a box of things. Instead, you'd see this box holds the key to saving lives. It's the difference between staying open and providing services or having to watch from the sidelines." On behalf of these organizations and the individuals they serve, I want to extend my deep gratitude to Monroe County, to Congressman Morelle, and also to all of you in the community for making this possible. You're watching out for each other, continuing to wear those cloth face coverings in public, for sharing your resources, and for stepping up and leveraging the power of collective giving to help our neighbors. COVID-19 is impacting all of us, and it will take all of us to defeat it. More information on how you can get involved is available at uwrochester.org, and thank you so much.
Thank you, Jamie Saunders, and thank you again, Congressman Morelle, Supervisor Seeley, and Commissioner Mike Mendoza. I do want to just show before I open this up to questions. These are the face coverings that that we've been able to purchase with the support of Congressman Morelle and our federal partners. And by the time we're through with this initiative, working with all the local governments, the towns, villages, city, and with the United Way, we will have distributed over 3 million of these face coverings across the county to any resident who wants one and folks who need them. So these are the types of face coverings. These are like surgical masks. We're very grateful to have these. So with that, I think we have a number of reporters on the line, and we can open this up for some time for some questions.
Okay, we'll start with Cameron Duganville from 13 Man, followed by Rebecca Pat from WROC.
Hi, good afternoon. First one, maybe more directed for Dr. Mendoza. How long do you realistically see the population here having to wear a mask?
Tanner, thanks for your question. That's really hard to tell, because the reality is that, we believe the current prevalence in the community of COVID-19 is still in the single digits. And so really it's a race between how long we can keep up with this and the race toward getting a vaccine or a treatment. And unfortunately, we don't have a crystal ball. And so my message to the community is, for the foreseeable future, let's start to make this a habit. And I know it's a weird habit, but let's try to make it a habit, because quite frankly, we don't know when this is going to end and how it's going to look at that time. So I think we ought to do what we can today to take advantage of the resources that we're now learning about, to do everything we can to protect our loved ones and our older adults and vulnerable people.
Follow-up probably more for you too, Dr. Mendoza. Wanting to ask about contact tracers. It seems like that's something that our area is kind of lagging on to be able to reopen. I guess, how many more do we need, and do you think we can get enough in time for our region to really be able to start reopening after next Friday?
There's no question. Every county in the country, as far as I am aware, is lagging to some degree in this regard. You'll probably notice that the metric for contact tracing is a regional one. And so this underscores the importance of collaborating with my counterparts across the region. The target that has been set for us is 361 contact tracers. We actually have 61 by our count as of yesterday evening here in Monroe County. And I have a call out to my colleagues to redefine how we are counting, because it turns out the definition for contact tracer is much broader than we thought it was. And so, very likely we have more than 100 in this region, but certainly it's a far cry from the 361 that we need. So we've been engaging with my colleagues and nursing students and public health students from all across our community, from all the institutions, Brockport, Nazareth, St. John Fisher, U of R, RIT, all of them. Great outpouring of support. Though we don't have all of the numbers in line right now, I'm very optimistic that if we were to have 361 in the very near future, I think we could step it up and get very close. So, more to come.
Thank you.
Pat is next from WROC, and Patty Singer from Minority Reporter. You're up after her.
Yeah, I think y'all did a great job summarizing it. So I don't really have many questions. The only thing I would ask, and I'm sorry to be annoying, I ended up having some technical difficulties and I missed the beginning. Did I miss any soundbite that stood out? Were you wrapping up like, oh, this is what today is about, and I missed it? I apologize.
Oh, no problem. Yeah, and I can briefly summarize for you, Rebecca, and we'll send a press release out as well. But essentially what we're announcing today is that the county, through its CARES Act funding secured by Congressman Morelle, has worked with our municipal partners across the county, as well as with leaders in the nonprofit community, particularly through the United Way of Greater Rochester, to purchase and distribute what will end up being over 3 million masks to residents in various nonprofits and governments throughout the county. Okay, you're welcome. Okay.
Patty Singer from Minority Reporter, and then Berkeley Green from News 10.
Hi, I don't want to spend a question if the news release is going to have all the details of how this is going to be distributed. So I don't want to waste a question on that. I have a question for Congressman Morelle. Based on what Dr. Mendoza just said, what would prevent a CCC, WPA type of effort for contact tracing and for other things that need to be done to address the long-term ramifications of this pandemic?
Well, that's a great question, Patty. I think that we are now going through the process of figuring all that out. You know, we've done 4 major bills that deal with coronavirus so far. They've largely been around providing support for our health systems, for our local governments, like the funding we're announcing today, and for individuals and families and small businesses. So that's why the unemployment enhancement money, that's why the stimulus checks, that's why we've done the Paycheck Protection Program. I think we're starting to look now at a couple things. And I know for me, and this is probably not the case of other people, but in the last week or so, clearly the original idea or concept I had was we were going to get through this over a period of a couple of months and then go back to normal. What's clear is this is going to be a very, very, very long, hopefully very flat, but very long time. And as Dr. Mendoza said, until we find a therapy that works or a vaccine that works, and that could take several months. So I think that has changed how I think my colleagues are starting to look at this, and the horizon's going to be longer. So I think we do need to start thinking about ways that the federal government will support efforts to really get at the public health issues and to reduce the spread. So that may be something that comes out of this. I do think part of the challenge, though, is there isn't unanimity yet around the country among governors and communities about what we need to be doing. And I think that's been one of my frustrations. There hasn't been a sort of a single message out of the White House about what people should do. And so folks are doing different things. And I think that's caused some challenges. And I'm not sure how everyone in the Congress would react to the idea of doing additional dollars for contact tracing. But it's certainly something that I think, we're thinking about, and something that could potentially be in a 5th or 6th bill over the next several weeks as we negotiate with our Senate partners.
Well, it seems as though you're paying for unemployment. If you could train contact tracers, you would do that. And to go to something else Dr. Mendoza said, Dr. Mendoza, I heard you say several times the phrase physical distancing. Is there something going on in the community now, particularly with the mental health ramifications of this, where people want to drop that social part away and have it more physical distancing so that people still can be connected to others, but just have a further proximity?
Well, ever since the beginning, I've always had my reservations about the term social distancing because, now more than ever, we want to remain as connected to one another as possible. And really what we're trying to establish is the physical distancing. So I'd like to shift our conversation more toward that 6-foot physical distance and do everything we can to come closer in a social way. But I think the most important thing is to maintain that physical distance, because again, that 6-foot perimeter is what's been shown to help decrease the spread of this virus. But now more than ever, mental health, that sense of connection, that sense of meaning that we all need to derive from our company with one another. I can't think of any more important time than now to emphasize the social connection part. But I do think we need to make sure we emphasize the physical distancing is really what we're after.
Thank you.
Thanks, Patty. Berkeley Green, you're up next, followed by Sean Lehman from the Democratic Chronicle.
Thank you. Question for Dr. Mendoza. Dr. Mendoza, I think you answered my question that I had on contact tracers. So let me move on to testing here. The governor's website still considers our region to be short on testing capacity. You believe that we meet the testing capacity metric. So who's right here?
I think we're all right. The graphic says that we need to have tests, not capacity. So I believe we have the capacity through the local health systems, through Rochester Regional, through U of R, and through the site that's been established by the state at the Monroe Community College. We have the capacity. What we don't yet have are the tests. And so the metric that we need to achieve is people actually going to get the test. And that's the part that we need to work together on. And I will add, that is not just a snapshot in time. That's a rolling average. So we can't just hit the mark and then sort of coast. We've got to continue to establish the 7-day rolling average of testing that exceeds the benchmark set forward by the state. So you'll notice that it's 30 per 1,000, I believe it is. So the math then shakes out roughly to 1,200 across the region per day. And here in Monroe County, I think we're upwards of 500 to 600 right now. We've been stepping up our game to improve testing locally in the county, largely through promoting the systems and the MCC site. But we've also been reaching out to our partners across the region, asking them, what do you need? How can we support you? Do you need more supplies? Do you need more reagent? This has to be a concerted effort. This can't just be a once and done. So I would say that getting to that testing mark is going to continue to be a challenge, but I think we're a lot closer now than we were 1 week ago.
And do you believe it's achievable by the middle of May?
Oh yeah, I do.
Thank you.
Sean Layman from the Democrat Chronicle, followed by Wendy Wright from Spectrum.
Yes, hi. On Monday, Governor Cuomo called on local governments to step up enforcement of mask wearing in public. I wonder if there's been any thoughts about whether or not to do that locally.
Sure, he did, and one of the things that's also noteworthy about the way the governor has approached this is it's been a regional approach, and taking into consideration each region's experience in terms of the spread of the virus and where they are in overwhelming the hospital system and slowing down their curve. Here in Monroe County, we've done a very good job, and I want to thank the community for their partnership and the sacrifices that they've been making to keep that curve flat and make sure that we're not overwhelming the hospital system. By and large, when I'm out and about in the community or when I go to the grocery store, I see the vast majority of people wearing masks when they should be wearing them. So the way we are approaching it here in the county is through an education campaign. I think it's always good to start with education. And so events like today, making sure that we have the ability for people to cover their face by securing and distributing face masks throughout the community, and then also engaging our community partners and folks like Dr. Mendoza to really demonstrate why it's so critically important, not just for your own health, but for the health of the people around you to cover faces. And I think that that's the right approach to take here in our region.
And to follow up, Dr. Mendoza and others have said we need to think about this as a marathon and not a sprint, to make it a habit to be wearing masks all the time, that we can expect probably to be doing that for months. Do you anticipate a need to do more than just this one-time supply of masks to local residents? Do you imagine that may become a regular thing?
Well, it's something we're going to obviously have to evaluate as we go forward, as we see what the supply chains look like, as we see what the curve looks like as we go forward. It'll be something that would obviously have to be reevaluated as we go forward, and we would obviously also do that in context of evaluating what the needs of each community is, because we are a large county and we're a very diverse county in many different ways, and so we will reevaluate that as we go forward and meet that need. But I'm a big advocate of when you ask the public to do something, and the public has been asked to wear face coverings, that you have to also then provide that avenue to be able to do that, and that's why today's announcement is so important.
All right, thank you.
You're welcome.
Okay, friendly Wendy Wright from Spectrum.
Hi, thank you. I think the first question is for Joe Morelle, following up on what you were talking about with requesting more funds from the federal government. There's been a lot of politicizing going back and forth here with the federal government saying that because the need is different in each community needs to basically follow up on what they believe is best for their own area. At the same time, hearing from Dave Seeley, we're trying to figure out how to all work together. And I think there is a lot of confusion on this. I don't know if it's Joe or whoever would like to address that.
Well, I think the great thing here is there hasn't been any confusion locally. I think the county executive has done an amazing job with daily calls with his government partners. And so I think here it's worked really well. I think it's been less well coordinated in other parts of the country. There's clearly been some frustration between state governors and the White House about what the various roles ought to be. I do think we have to work on that long term. I don't think this has been the best demonstration of federalism at work. I think there have been a lot of starts and stops. I don't think states ought to be competing against one another for personal protective equipment. I don't think states ought to be outbidding one another for ventilators. That's really what I think the federal response ought to have been. But here locally, I have to say, whether it's, and I was on a Zoom call early this morning with Supervisor Bill Smith of Pittsford. I talked to town supervisors. I try to reach into them just to find out what's going on with them. Obviously the mayor, I talked to the county executive several times a day, as well as Supervisor Seeley. So I think we've done a great job here. I think it's their leadership, but obviously we would need to do, and I think we ought to be prepared, because this can happen again, whether it's a resurgence of COVID-19 or another virus, a pandemic 5-10 years from now. We just have to be better situated as a country to work together and resolve these issues. But generally speaking, I think you're right, Wendy. We want local communities within certain guidelines to be really making the judgment about where they want to put their resources, what the response ought to be. I think this step today is clearly an initiative of the county. We're pleased to be able to get the resources, but the county has prioritized it. And obviously the county executive and the county health director have made this judgment. I think it's the right one, but this is one we want them to be able to make.
And then follow up on the testing. I feel like there's still a lot of confusion about testing, and if people are now going to start gradually going back to work, if you go get a test, so you know maybe you get results and you're okay, then you go to work and you're around some other folks, you'd almost feel like you need to go get a test again. So what's the status with repeat testing, and how often do they need it?
Dr. Mendoza, you might be muted.
Okay, there you go. I think I.
Okay.
So I'll take that question about testing. So to clarify, there are two types of tests that we're dealing with here. One is the diagnostic test, the nasal swab, if you will. And what that does is it will tell you if you're sick right now. And so we're encouraging people to get that test right now, because we know that there are people who are asymptomatic who may be contagious. So particularly around essential workers and healthcare workers and so forth, we want to encourage that test. But that test, if it's negative, doesn't carry a warranty. So if you go to work in a week, that doesn't really, you're having had a negative test a week ago doesn't tell you, anything that you didn't, that you can't know without getting another test. So, we don't have any strict guidelines on when it would be appropriate to get a repeat test, but generally speaking in clinical practice, every week, if somebody is truly at risk for having come into contact with somebody, is certainly very reasonable, particularly if you're in a essential, healthcare field or other frontline field. The antibody test, on the other hand, is the test that's still on the horizon. And unfortunately, we don't have good science yet to back that one up. The science that is available now is telling us that there is still, unfortunately, a very high false positive rate with that antibody test, which means that there is a risk that if you get a positive result, you may not actually be immune, which then opens the door potentially to somebody going out with a false sense of security, leaving their face covering at home, not observing the physical distancing, and potentially putting other people at risk. So, we're not at the point quite yet where we want to recommend the antibody test, and it's not yet available quite as widely as we would like. But so for now, I think the message is, if you're an essential worker, whether you have symptoms or not, please go get tested. And certainly if you are having symptoms, call your doctor or consider getting the test at the MCC site.
Great, thank you. I thank you all for joining us tonight. I want to, or this afternoon, I want to again thank my partners in government, Congressman Joe Morelle, for all of your help and support of this community throughout this crisis, Supervisor Dave Seeley and all of your colleagues who I had the pleasure of speaking with yesterday and on an ongoing basis about how we can help them better meet the needs of the residents. Dr. Mendoza, you and your team are just doing an outstanding job for this community, and Jamie Saunders, you and your team at the United Way has been a great partnership. I want to underscore before we hang up here, one thing that Dr. Mendoza did just say, which is about testing and how to access that testing. If you go to our website, www.monroecounty.gov, again, it's monroecounty.gov, we have links to the state resources, particularly for the MCC site. If you're an essential employee, even if you're asymptomatic, you are able to get a test at the MCC location. It's a drive-through site in their parking lot. You do have to make an appointment, and you can do that either online or by phone. There's a 1-888 number that you can call, and that's available. All that information and resources available and linked to on our website at monroecounty.gov. And I would encourage all essential workers and also everyone in our community who thinks they may have a symptom to please check out that link and utilize that test location that the state has provided us in the MCC parking lot. So thank you all very much again. I appreciate your partnership and your help and support, and have a great rest of your afternoon.